Today, we're going to talk about the early signs and symptoms of fibromyalgia. And I know some of you have had fibromyalgia for literally decades, but I really want to share the content because there are people that are wondering if they have fibromyalgia. And as you well know, fibromyalgia is a chronic condition that is characterized by widespread musculoskeletal pain as well as other symptoms. The exact cause of fibromyalgia is not very well understood, and its symptoms can vary from person to person. However, there are some common early signs and symptoms associated with the condition. They may include widespread pain. Now, the hallmark of fibromyalgia is chronic widespread pain. This pain is often described as a constant dull ache that affects both sides of the body and can vary in intensity. It may be felt in muscles, ligaments, and tendons throughout the body. So think about it like this. If you had worked out the day before or worked hard the day before, you might wake the next day with muscle pain and stiffness. Well, think about this type of pain that never goes away. So you feel it one day, you may not think much of it. You feel it a second and a third and a fourth day. That could be the onset of fibromyalgia. Then there is tender points. In the past, fibromyalgia was diagnosed based on the presence of tender points in specific areas of the body. These tender points are sensitive to pressure and are often found in symmetrical patterns or pairs. However, modern diagnostic criteria have shifted away from these tender point assessments. Then there's fatigue. So I think those two, the muscle pain, the tender points, and then fatigue are probably some of the early signs of fibromyalgia. Many people with fibromyalgia experience severe fatigue even after a full night's sleep. This fatigue can be both physical and mental, often described as fibro fog, where I'm so tired and fatigued I can't think clearly. It includes difficulty with concentration, memory, and mental clarity. Then there are sleep disturbances. Sleep problems are really common in fibromyalgia. Individuals may have difficulty either falling asleep or staying asleep or experience restorative sleep, leading to a feeling of unrefreshed sleep. Guys, sleep is often associated with adrenal issues. Now, remember, your adrenal glands are basically your stress glands. And people with fibromyalgia have often been under prolonged stress, which means that their adrenal glands potentially can be fatigued. And part of that problem will result in sleep disturbances. Then morning stiffness. So not only morning pain, but people with fibromyalgia often wake up with stiff and tender joints and muscles, similar to morning stiffness seen in arthritis. Headaches, frequent headaches, including tension type headaches and migraines, can be symptoms of fibromyalgia. Now, irritable bowel syndrome. Some individuals with fibromyalgia may also experience gastrointestinal symptoms like abdominal pain, bloating, diarrhea, or constipation. Now, I'm going to tell you this after 15 years of working closely with people with fibromyalgia, predominantly women. Everyone that has fibromyalgia has a gut issue. Now, it may not be as pronounced as others, like IBS, but it could be, like I mentioned, gas, bloating, indigestion, things along those lines. Then there's sensitivity to temperature and noise, heightened sensitivity to temperature changes, as well as sensitivity to loud noises and bright lights are really common in fibromyalgia. Then there's depression and anxiety. Fibromyalgia is often associated with mood disorders, including depression, anxiety, which can either contribute to or result from the condition. Obviously, if you're waking up every day for weeks and months and years with horrible muscle pain, fatigue, and brain fog, that could lead to depression because you have no desire to do things with your family any longer because you simply struggle to get through the day. Then some people have numbness and tingling with fibromyalgia reported in your extremities potentially. So it's important to note, as I mentioned, that fibromyalgia symptoms can overlap with other conditions, which make Diagnosis challenging. If you suspect you have fibromyalgia or are experiencing these symptoms, it's essential to consult a functional medicine practitioner for proper evaluation and diagnosis. Now, remember, a functional medicine practitioner actually specializes in chronic illness as opposed to a general practitioner who has a wide knowledge base from strep throat to the flu to even diagnosing cancer. And they normally will take care of the smaller things in their own office with medications and refer out larger issues to a specialist. Now, fibromyalgia is a clinical diagnosis, and your doctor may use a combination of your medical history, physical exam, and other tests to rule out other potential causes of your symptoms. Now, if you're in need of a conversation with a functional medicine practitioner, I do speak to people all over the country and treat them as well, either over the telephone or through a Zoom link. So if you'd like my help, feel free to call our office directly. Thanks, guys, for your time and attention. God bless you. And I do wish you the very best of health.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.